So sports enthusiasts or elite sportsmen end up having injuries in their shoulders, and the common ones that I or my colleagues see in practice include rotator cuff tendinitis. We see long head of biceps tendinitis. We see shoulder dislocations, which is the injury to the bumper on the front, top, and back, which is called the labrum. So labrum injuries that we see in the shoulders, and on occasions, fractures as well. These are because of the fact that the shoulder is an immensely mobile structure, and there are lots of muscles attached around it and about it. Those are the ones that get inflamed because of repetition of overhead work, such as in tennis players and golfers. These are the ones where we need to pick these up sooner, investigate them sooner, and help them out so that they can get back to their routines and sporting activities. Yes, I would say listen to your body. Pain is the natural indicator of telling you that there is something wrong in your shoulder joint. I would always ask in my clinical practice, in my clinics to patients, do you think you can manage to complete a session of the sport that you do? Do you think that during your sport, your shoulder stiffens up? Do you think that you feel that the shoulder may pop out of joint, or there is continuous pain during your sporting sessions? If that is the case, I would recommend you to seek urgent specialist opinion so that we can pick up damage before it can get permanent. Right. So yes, I think we would love all of our patients, whatever age group they are, from the young to patients in their 6th and 7th decade, to carry on pursuing their hobbies. We would suggest that if they feel that their hobbies are being affected, including sports, because of pain, it may be a good idea for them to come and have a chat with an orthopedic specialist with regards to the duration of pain, with regards to the degree of disability that has come over the time whilst they've been playing the sport. Have they got any other joint pain? And has the pain actually reduced their efficiency or their performance during sport? That would be a good time to come and have a chat so that we can guide them and carry on maintaining a certain amount of performance as well as their leisure activities. It's very hard to put a percentage on how many times, how many people would end up needing surgery. Certainly in my clinical practice, I would get the ones that have had all forms of treatment done with their family physicians in terms of medications, in terms of physiotherapy, and in terms of quite possibly injections. So we now at that point already know that we've exhausted all non-operative options. So a major bulk, I would say about 80% or so, would have already been seen by my family physician colleagues. And it's the 10% that come in that end up needing some form of surgical intervention. It's got fundamental, pivotal role on all forms of shoulder injuries. Physiotherapy is something that happens before, so we call it prehab. Just even if somebody's got injury, they would have specific physiotherapy done. They would have their procedures and surgeries, and then move on to some form of physiotherapy almost straight away. It plays a massive role in rehabilitation, in terms of outcomes, in terms of the patients getting their confidence back in order to enjoy and pursue their hobbies and their sports. So the physiotherapy surgery, in my opinion, is of no use if physiotherapy doesn't happen before and after the surgical procedure.